Model Hailey Bieber announced earlier this month she's suffering from a large cyst in her ovary. About 10 out of every 100 women have ovarian cysts, and they're usually non-cancerous. They rarely cause problems, but they do lead to pain and sometimes other symptoms. On Instagram, she posted this picture for her followers saying she has a cyst in her ovary that's the size of an apple, calling it painful and achy.
A lot of women get very frightened when they hear they have a cyst, and the majority of them are really inconsequential. Cysts are only problematic if they're causing symptoms, and symptoms might be persistent pain or severe pain, or if there, are concerns that it may be a cancer or maybe a precancerous kind of tumor.
You should seek immediate medical care if there are any signs of the ovary actually twisting. And those signs are usually sudden, severe abdominal pain accompanied by vomiting and fever. So let's talk to Dr. Payal Kohli about this, because it seems scary when somebody says the size of an apple, your first reaction is, what? That's big to be inside of me. This is common though.
Very common. In fact, I think most of us either have had it or know women, our moms, our daughters, our sisters, our friends who have had it. So, the ovary's job is to make eggs every month, to release eggs. And as those eggs are being released, sometimes they turn into what's called a functional cyst, which means the egg doesn't quite pop out of the ovary, just kind of stays there, creates a fluid-filled sac. Those are usually pretty benign and harmless. They go away on their own. Sometimes it stays there and grows bigger, fills with more fluid, or sometimes you have something called an anatomical cyst, where you actually have cells that come together to make a cyst, and those are the ones that can get really, really big.
Well, I mean, like for somebody like her, people are always asking, are you pregnant? Are you pregnant? She's married to the Biebs. And this is, first of all, it's very private for a lot of people. Famous to have this come up, but also they can grow, as you mentioned, pretty big. And then what's the hope that when do they go away, and how does that work out?
Yeah, the ovaries are usually the size of an almond, Kim.
Oh, okay. They're tiny when we think about that.
You're talking about an apple, but we've seen grapefruits, we've seen soccer balls, we've seen cysts get really, really big.
Soccer ball?
Yes. And a woman's pelvis is really designed to hold a baby. So oftentimes the cyst will actually grow down rather than growing out. So women might not even see that curvature of their belly change or anything. They may not realize it. So the symptoms may be really subtle, like bloating or, having to go to the bathroom really often to urinate, or pain during intercourse. Any of those type of subtle symptoms can occur. But if you start to see abdominal distension occurring, or if you know that you have a cyst, don't count on it going away. You really need to go to a doctor, get it checked out, because there is a possibility it could be cancerous, or a possibility that it could rupture, or it could cause that twisting of the ovaries that can be a life-threatening complication.
So if you don't know and you're not feeling anything, don't worry. But if you do know and you're thinking, I don't feel great, right away get in.
Absolutely. And listen to your body, because your body, your menstrual cycle, the way your body looks, the way your body feels, those are all subtle clues that might tell you. And sometimes it's just weight gain. You might just notice that you've gained a few pounds and you want to go get it checked out by your gynecologist to make sure that you're not developing a cyst. Now, some women will have syndromes like polycystic ovarian syndrome, which can also be associated with things like excess androgen. So you get, deepening of the voice, you get excess hair growth, you can get broadening of the shoulders. That's a whole different kind of a thing. But the usual kind of functional cysts usually go away on their own, but they can become problematic. So get it checked out.
So when you're talking like something of soccer ball size, they're going to need some kind of treatment.
That's absolutely right. And that's how we decide basically whether something needs to be treated or not. The size is a big thing, because it starts to push on the other organs. You really don't want that kind of situation. The other is cancerous. If the larger it gets, the more cells there are there to become cancerous down the road. So you really want to make sure if there's any tumor markers elevated, or any imaging like MRI or ultrasound that suggests it's not just a cyst, it's not fluid, but there's actually some malignant looking features to it, then that's some time to take it out. And then the other time to take it out, of course, if it's causing any kind of symptoms.
So the big takeaway is, I guess, don't panic.
Don't panic, very common.
But listen to your body.
Listen to your body and get it checked out. Those are the big takeaways. And so if you have a friend or a family member or somebody who talks to you about this, encourage her to go to her gynecologist, have them take a look. It's a quick little imaging test. It's an ultrasound, gives us a lot of information about whether or not something needs to be done.
Okay. Once again, sometimes these celebrities do a lot of good things when they put something out there and just share it with the world.
100%. I think social media is a powerful way to disseminate knowledge, and I'm so happy that these celebrities are doing that.
Okay. Thank you, Dr. Kohli.